Recently, there has been a significant increase in the popularity of prescription drugs approved to treat obesity, and according to Pew Research, nearly 2 million Americans are taking part. Joining me today is Dr. Michael McCullough with Carolina Preventive Medicine to talk about weight loss drugs and some of the things people should be aware of. Thank you very much for being here with us, Dr. McCullough.
Thank you, Raphael. It's my pleasure.
Weight loss drugs have become something of a thing here within the last few years.
Yes, and obviously, weight loss and obesity is a very important part of trying to improve America's health, because we have an obesity epidemic like many other countries. The drugs that we're talking about, the GLP-1 agonists, were initially developed to treat diabetes, and it was found that one of the side effects is weight loss, so they've also been approved for that purpose as well.
Now, are weight loss drugs considered cheating, or is that a safe and healthy way of losing and getting rid of weight?
Well, we know that obesity is very complicated, and it's often genetically related. It's not a matter always of just eating right and exercising. There's a lot of hormonal changes that go along with weight loss and weight gain, and the newer medicines that affect those hormone levels. So I wouldn't consider it cheating. I would think of it more as a tool in the war against obesity.
Now, if you take those medicines to lose weight, do you put yourself in a place where you have to continue taking them to keep the weight off, or if you stop taking them, will it come back?
Oftentimes it will come back. There are some people that once they lose the weight, they can maintain their lower weight, but many people, the weight will come back when they stop them.
And earlier you were telling us about some added benefits to taking these weight loss drugs. You want to share with our viewers about that?
Yes, so we've known for decades that diabetes causes a lot of complications, and the hope was that when we lowered blood sugar, we would reduce those complications, and that held true for some of them, like kidney and eye damage. But in terms of heart attack and stroke, which is the main cause of death in people with diabetes, lowering the blood sugar did not impact that significantly. Well, the data on the GLP-1 agonist shows that not only does it reduce the risk of heart attack and stroke and death, it also does so in people who are at risk that don't have diabetes. So the FDA has given Wegovy an indication to reduce those risks in people who are overweight regardless of their diabetes status.
And you mentioned potentially there being some news that would help Parkinson's patients or patients of dementia.
Correct, yes. Two of the medicines, dulaglutide and lixisenatide, have been shown in clinical studies to reduce the symptoms of Parkinson's disease, especially when given early. And there's ongoing research in a study that should come out next year looking at neuroprotection and dementia as well.
All right. But I imagine before you get ready to try to take any medicine, it's best to consult with your physician.
Don't want to take these unless it's prescribed by a licensed healthcare professional.
All
yes.
right. Thank you so much for being here with us.